Good morning.
Good morning, doctor. How are you today?
Good. Can you tell me your name, please? Telemedicine is a fairly new medium. It's a way of a doctor and a patient interacting with each other. Obviously, it's telemedicine, so you're not face to face with them in an office like a traditional practice or in the hospital. Most of the conditions that I get are for upper respiratory infections. For example, somebody's got sinusitis, or they got a cold, or bronchitis, or a sore throat, or strep throat. Those are probably by far, the majority of the cases that I receive. Do you have any other medical conditions related to your lungs, for example? The reason I like telemedicine and being at the beginning of the industry is that it's growing, and there's a lot of very interesting things going on in terms of technology, but also there's a lot of movement in the political and legal arenas in terms of, okay, can a physician in every state practice telemedicine? And one of the major hindrances is that in the US, you have to have a license in each state to practice medicine. And that doesn't matter whether it's telemedicine or traditional medicine. So for example, I'm based here in Florida. I have a Florida license, obviously, to practice medicine in Florida. But if I want to consult with a patient through telemedicine in, let's say, Idaho, I need a license in Idaho as well. I don't think it'll replace traditional medicine, no. It'll be an adjunct for patients who have simple issues or who are between doctors or need a refill. I think when I can do more of a physical exam of the patient, get access to their prescription records, not just from what they've ordered through the service, but from their private physician as well, or from the hospital. When I can take a look at their lab results, then I can actually establish a relationship with these patients, say, okay, look, you need to see your private physician, but maybe just every 6 months or every year, I can help manage your diabetes or your blood pressure. Obviously, we can't prescribe any controlled substances, so no narcotics, any Schedule II DEA drugs. And there's good reason for that. We want to make sure that the patient is taking it for a legitimate reason, that there are objective findings for that, and that they're not diverting it for any other purpose. Any other symptoms with this? For example, shortness of breath or sore throat? Right now, I could not do this full time. There isn't as much business each day to support that. So I do this as supplemental income, and that's why I do hospice as my primary job. I think one day in the future, when it becomes more robust and more involved in that you can interact with a patient and actually maybe get diagnostic information from machines or sensors, all these sensors coming out every day for different things, maybe then it would be, more people would use it more often, and it could be a full-time thing. But I think right now it's not at that stage.